Welcome to IVC. We look forward to helping you live as healthy and active of a lifestyle as possible. Our team is committed to providing you with state-of-the-art personalized care. IVC is nationally accredited with board-certified physicians who are fellowship-trained in vascular and interventional radiology. Interventional radiologists are on the cutting edge of clinical advances and use the latest image-guided technologies in the treatment of many medical conditions that once required open surgery. Their expertise includes management of arterial and venous disease, including peripheral arterial disease, varicose veins, blood clots, and other vascular disorders. You will also work closely with our experienced nurse practitioners, nurses, physician assistants, specialized sonographers, medical assistants, and office staff. IVC is committed to helping you through each step of your care, and we want you to be as informed as possible about your condition. Although there are many causes of pelvic pain and heavy menses, benign tumors called uterine fibroids are one of the most common causes. We hope this video will provide you with important additional information to help you understand uterine fibroids and your treatment options. Uterine fibroids. Uterine fibroids are benign tumors that originate from the uterine muscle tissue. Fibroid growth is dependent on estrogen and progesterone and is rare before puberty. Fibroid growth increases in prevalence during the reproductive years and often decreases in size after menopause. Uterine fibroids can alter a woman's period and cause a variety of bulk pelvic symptoms. Fibroids are found in up to 80% of women in the United States by the time they are 50 years old. Fibroids are benign and do not spread to other regions of the body. Most fibroids do not cause any symptoms, and the risk of malignancy for uterine fibroids is very low. Symptoms. The symptoms and treatment options depend on size, number, and location of the tumors. The most common symptom is excessive menstrual bleeding. Fibroids often cause bulk symptoms, which include pelvic pressure, bloating sensation, urinary frequency and urgency, low back pain, and constipation. Diagnosis. It is important to differentiate between other possible causes of uterine growth and abnormal bleeding. A correct diagnosis will determine the proper treatment for you. Other causes of uterine growth and abnormal menstrual bleeding include adenomyosis, endometrial polyps, uterine malignancy. Because most women will not exhibit every potential symptom, the diagnosis is usually confirmed by using imaging of the pelvis with transvaginal ultrasound or MRI. Ultrasound uses sound waves to get a picture of your uterus to confirm the diagnosis. The technician places the ultrasound device, transducer, over your abdomen or in some cases inside the vaginal canal to get images of your uterus. Magnetic resonance imaging, or MRI, is a non-invasive test that uses a powerful magnet to view size and location of the fibroids, exclude other types of tumors, and help to determine appropriate treatment options. Treatment options. At IVC, we specialize in uterine fibroid embolization, UFE, which targets the abnormal blood supply to the fibroid, causing the fibroid to shrink. UFE avoids surgery and can preserve your uterus, control symptoms, while improving quality of life. Approximately 9 out of 10 women who undergo uterine fibroid embolization will experience significant symptomatic improvement. Patients are generally able to resume most daily activities within 1 to 2 days after the procedure. Hysterectomy, or surgical removal of the uterus, provides a definitive cure for women with symptomatic fibroids who do not wish to preserve fertility. Hysterectomy can be performed through an abdominal incision or using a less invasive approach with laparoscopic assistance. Recovery ranges from 3 to 6 weeks depending on the procedure. Myomectomy is the preferred surgical procedure for women with submucosal fibroids who wish to preserve their uterus or fertility. This procedure consists of surgically removing the fibroid from the uterus while leaving the uterus intact. Recovery from this procedure is slightly less than that of a hysterectomy. Hormone therapy can be used to temporarily relieve heavy menstrual bleeding and menstrual pain. These treatments can also shrink fibroids, but can't make them disappear completely. Hormones are usually only used for a limited time because of the risk of side effects. Fibroids may regrow once hormonal therapy is stopped. Uterine fibroid embolization is performed under imaging guidance with intravenous conscious sedation. An interventional radiologist guides a very thin catheter, about the size of a strand of spaghetti, into the specific artery supplying the blood to the fibroid. Once the catheter is in the proper position, the doctor releases small particles into the targeted arteries, which causes the fibroid to shrink. When the embolization is completed, the catheter is removed and local pressure or a vascular closure device are utilized to prevent bleeding at the arterial access site. In order to minimize discomfort, patients are given medication before, during, and after the procedure to reduce inflammation and help alleviate procedure-related pain. Patients can typically resume most normal daily activities within 24 hours following embolization. Following UFE, some women may experience discomfort relating to post-embolization syndrome, including pelvic pain, cramping, nausea, low-grade fever, fatigue, or discomfort. These symptoms generally resolve with conservative treatment within 2 to 7 days. Depending on the location and size of the treated fibroid, some women may also experience some vaginal discharge for 1 to 2 weeks after the procedure. This occurs because the tissue of the fibroid is dying and may slough off into the endometrial cavity. Associated treatment risks. As with any medical procedure, and in spite of our efforts to keep you safe, there are known potential associated risks with uterine fibroid embolization. Although uncommon, these risks include infection, bleeding, early menopause, and persistent symptoms. Bleeding can occasionally occur at the groin access site. This risk is minimized by using a vascular closure device that seals the small hole at the groin access site. Infection risk is minimized by our use of strict sterile techniques. You will be instructed to keep the vascular access site clean and dry for several days after your procedure to prevent infection and scarring. Antibiotics may be prescribed in select cases to further reduce infection risk. Please let us know if you have undergone heart valve or joint replacement surgery, or if you have other conditions that may require pre-treatment antibiotics. Early menopause. Because blood flow to the ovaries may be altered during the procedure, there is a small risk of inducing early menopause, especially in women over 45 years of age. Persistent symptoms. In spite of undergoing a technically successful procedure, your symptoms may persist, reoccur, or even worsen. For most patients, however, the benefits of UFE outweigh the potential risks. Please let us know if you have any questions regarding the potential risks of embolization. Conclusion. Symptomatic uterine fibroids can impair your lifestyle and result in significant disability. With the help of your gynecologist, primary care provider, and our team of vascular and interventional specialists, you can generally achieve significant relief of symptoms. While we cannot alter many of the risk factors that predispose you to developing uterine fibroids, we'll do our best to help you manage your condition. You'll have time to consult with us in greater detail before any procedure we perform. If you have questions or concerns, or if you experience any complication following a procedure, we want to hear from you as soon as possible. Our providers are on call 24 hours a day and can be reached after hours through our office number at 801-379-6700. If you would like more information about your specific treatment process, visit ivein.com or ask one of our providers. We hope this video has helped you better understand uterine fibroids and the associated risks and benefits of treatment. If you have any questions or concerns at any time, please ask one of our providers or office staff members. We look forward to working with you.